Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and today we'll be doing some important questions from immunity. And the immunity session will be covered after this. Just a second, please excuse me. So as we know that Unacademy is the India's largest learning platform in which we assess both the live and the recorded session because the learners can watch the recorded sessions whenever they get the time, especially for those doctors who are at the periphery. And that to learning from the India's topmost educators. And you can personalize your learning experience by following your favorite educators on the Unacademy app as well as on the YouTube, because the sessions of the Unacademy are totally free of cost on the YouTube as well as the Unacademy app, right? So now you can can do the live test in the quizzes and can solve your queries, can study on the device at your choice, and can assess the topmost MCQs by the topmost educators. Soon the printed notes will be coming with the plus subscription. Now one is the iconic subscription. The PrepLadder has come together with the Unacademy, and as we know, the video lectures of the PrepLadder are very famous, and the rapid revision courses of the PrepLadder are very high amongst the NEET PG aspirants. So Unacademy has come together with the PrepLadder, so you can see the recorded classes, can attend the comprehensive, and can read those notes, and can do the prepare your best of the lecture from both of the topmost education platforms that is present online. And if you take the 12-month subscription, 2 month subscriptions will be totally free, and that is totally worth this because compared to other online coaching institutes that is present, Unacademy is very cheap and economical compared to other online education platforms. And if you take 4 year subscriptions for plus, it will be around 60,000, right? So I will recommend you to go for those students who are second year and third year, can go for the 4 subscriptions. And if 1 year subscriptions, it will be around 40,500 after 10% discount. And please do use my code, that is Muskan 10, to get 10% of the discount on the NEET subscriptions. Now every day grant tests are being provided by the Unacademy platform, so you can attend those grant tests and can evaluate your performances, that too from 9 a.m. to 12:30 p.m. And the educators have done a lot of hard work to prepare the grant test, and specifically the clinical correlated questions because an image based question, because something that is very newly introduced, and the clinical questions are forming a bulk of the questions, the main examination, and long questions are coming, so you can actually take down your practice. So coming to the first question of today's, that is the super antigens causes what? So superantigen causes what? Superantigen causes the enhancement of phagocytosis or polyclonal activation of the B cell, antigen presentation by the macrophage or by the activation of the complements. Now, when we read about the superantigens, we already saw that the superantigen and this T independent antigen, they were activating what? They were causing the polyclonal activation of the B cell. Okay, they were causing what? They were causing the polyclonal activation of the B cell and causing the hyper gamma globulinemia, because super antigen, they actually directly activated the T cell, and T independent cell, they directly activated the B cell, causing the polyclonal activation of the B cell. Now super antigens, they activate T cell directly. The key point is to remember that they form the bridge between the MHC class 2 of the antigen presenting cell with the T cell, right? And the variable they appears to be the receptors, that is the variable beta region of the T cell receptors appears to be the receptors for the super antigens and causing what? The hyper gamma globulinemia. Now examples are important, that is toxic shock syndrome, food poisoning, and scaly skin syndrome. Apart from the bacterial, the examples are very important, that for the staphylococcus, it is what? It is TSST1 exfoliative toxin, enterotoxin, ठीक है? And for the streptococcus, it is streptococcus enterotoxin A and the C, exotoxin A and the B. इसके अलावा अपने पास यार्सिनिया के 2 टॉक्सिन हैं, and last is the mycoplasma. ठीक है? Now another important are the viral, that is the EBV, CMV, rabies, and HIV, that we have to remember. इसके अलावा that is one fungal, that is Meliseae furfur. All the examples of the super antigens are very important. Please remember it by heart. Now, which part of the bacteria is mostly antigenic? That is the protein, carbohydrate, lipid, or the nucleic acid. That is which part is most antigenic. We already read कि जब फैक्टर्स जो इन्फ्लुएंस करते हैं एंटीजेनिसिटी के, भी डिपेंड करते कितने अमीनो एसिड है. द मोर अमीनो एसिड दैट इज प्रेजेंट, द मोर एंटीजेनिक द सब्सटेंस विल बी. सो प्रोटीन, ठीक है, later formed by later than carbohydrate, and least is was a nucleic acid, that is protein, carbohydrate, lipid, and last is what? The nucleic acid. Okay, so this is the sequence of the antigenicity, and we have to remember that is the protein, carbohydrate, lipid, and the nucleic acid. Now T independent active antigens act through what? Macrophage, B cell, CD8 T cells, or CD4 T cells. So T independent antigen actor, we've already read that, because अगर अपन को ऐसे भी नहीं पता, from the name we can easily guess out that we are talking about the T independent antigens. So CD8 T cells तो होंगे ही नहीं. Now we have read about the super antigens and the T independent antigens. Now they were causing what? They were causing the polyclonal activation of the B cells. ठीक है? And the T independent antigens के क्या क्या example थे? We read that is capsule, जो सब कुछ बाहर बाहर प्रेजेंट है, दैट इज द कैप्सूल, फ्लैजिला, एंड lipopolysaccharides. ठीक है? They were also causing what? The polyclonal activation of the B cells, causing the hyper gamma globulinemia. So that is the X through the activation of the B cells. Now, T cells, T independent cells, antigens and T independent antigens. Most of the antigens are T dependent. जैसे normally present होता है, that is antigen will present it toward the APCs and that will present it toward the T cell. They will activate the B cell and form the antibodies. This is a normal mechanism. लेकिन T independent antigen क्या होता है, जैसे कि bacterial capsule हो गया, flagella and the lipopolysaccharide, the classical examples that we have to remember. They do not need the T cells and the APC, though these two steps will not be included directly activation of the B cell, causing the increased release of the antibodies and the polyclonal non-specific polyclonal activation of the B cell, causing the hypergammaglobulinemia. Now, superantigens are found by all of the following pathogens except, very easy question this is. Superantigens are produced by all of the following, that is staph, Enterococcus faecalis, rabies, and virus. Staph, strep, mycoplasma, yeast, this Yersinia. We have read in bacteria, in the virus, we read about the rabies, HIV, EMV, CMV, right? So, Enterococcus faecalis doesn't produce the superantigens. Now, superantigen is a bacterial product that binds to B7, CD8, 28 co-stimulative molecules or bind to the beta chain of the TCR, binds to the CD4 molecule causing the T cell activation, or is presented by the macrophage to a larger than normal number of T helper CD4 T lymphocytes. So what is true in this case? For the superantigens, that is what? So superantigen is a bacterial product that binds to the beta gel that binds to the variable region of the beta chain of the TCR. Now, superantigens are the erythrotoxin of Staph aureus, Clostridium difficile toxin, or Staphylococcal TSS, or the cholera toxin. That is very easy. It is what? It is Staph TSST. Now, all of the following statements about the carbohydrate antigen are true except that it has lower immunogenicity, memory response is seen, causes a polyclonal B cell activation, and do not require stimulation by the T cell. What is true in this case? That we are talking about the carbohydrate antigen. First, remember that we are talking about the carbohydrate antigen. Okay, so we are talking about the lipopolysaccharides and we are talking about the T cell independent antigen. So whatever happened with the T cell independent antigen, that is, it has lower immunogenicity, it is true, causes a polyclonal B activation, this is also true, and doesn't require stimulation by the T cell, it is also true. And memory cells is not seen because it is active, actually the activation of the polyclonal cells only. Now, the protection against the smallpox by previous infection by the cowpox, that the person has the infection with the cowpox but is showing the protection for the smallpox. Now, this represents what? Antigenic cross reactivity, antigen specificity, passive immunity, or the innate immunity. So this is due to what? This is due to antigenic cross sense reactivity. Okay, because smallpox and cowpox, they have the antigen similarity and cross reactivity. Therefore, the antibody response to one vaccine can protect the other disease. Now, which of the following statements are true about the haptens? That they induce the brisk immune response, they need a carrier to induce immune response, and it is a T-independent antigen. It has no association with the MHC. Very easy, that is what? Because haptens are what? They are the incomplete antigens and they require what? So, what is the answer? Because haptens are what? The incomplete antigens. ठीक है, and they will require a carrier to completely act as an antigen, and after requiring a carrier they will act as an antigen presenting to the APCs, right? But the antigenicity में जैसे that is produced, that is immune response that is produced by the hapten is what it is not brisk, it is the slow and the sluggish, and it has no association with MHC. So what is the true statement? That it needs a carrier to induce an immune response, because hapten itself actually they are do not have the capability to show the immunogenicity. Now hydrophile antibody is found in it is found where? In veal phalanx. Other examples of the hydrophile, one is the veal phalanx, bulbinal, called agglutination test. ठीक है, that is the veal phalanx, and bulbinal for infectious mononucleosis, and the agglutination test. We'll not read the much about the theory because we have covered a very long session on the immunity chapter. So I'll skip up the theory. All of the following interaction occurs between the antigen antibody reaction occurs, that is the ionic bond, covalent, hydrogen, or the van der Waals forces. Now which of the following interaction doesn't occur? Now what happens is that when we talk about the antigen antibody reactions, we have seen कि जो ionic bond, hydrogen bond, and van der Waals forces, they are the weak forces that are present between the antigen antibody, and they are reversible, right? But when we talk about the covalent bond, it is a very strong bond between and the two molecules, and the covalent bond is not present between the antigen antibody, and a covalent bond is an irreversible strong bond that is absent. So it is antigen antibody is reversible, and the bound together by the weaker bond such as ionic, hydrogen, and the van der Waals forces rather than a stronger bond that is a covalent bond. Now action of the papain, this is a very important question because the actions of the enzymes are important to remember. That is a action of the papain what on an IgG molecule produces what? That is 2 Fc fragment with 1 Fab and 1 Fc with 2 Fab, or 2 Fc with 2 Fab, or 1 Fc with 1 Fab. Now we have seen that papain enzyme, it acts over the H region, that is a fragile region of the antibody, and it breaks down the antibody into what? 2 Fab fragment and 1 Fc fragment. ठीक है, क्योंकि यहाँ पे तो अपने फैब फ्रेगमेंट होते हैं, एंड दिस इज व्हाट द एफसी फ्रेगमेंट, एंड वेयर डज द papain act? It acts over the hinge region of the antibody, and where does the pepsin will act? It will act below the hinge region of the antibody, so this that will produce the that is the two fab fragment with smaller fragments of the Fc. So what is two? That is two fab fragment and one Fc fragment for the papain. Now, enzymatic papain tension we have seen that is above the disulfide branch of the hinge region, causing what? 2 Fab and 1 Fc, right? And when we talk about the Fc, because it breaks down below the hinge region, so small part of the Fc fragment is present, and it is fragmented by the enzyme, that it is not counted as a single Fc fragment. So smaller fragments of the Fc fragment and 2 Fab fragment. ठीक है, एंड व्हेन वी टॉक अबाउट द मरकेप्टा इथेनॉल, ना मरकेप्टा इथेनॉल क्या करता है? जो एंटीबॉडी होती है उसमें जो डाइसल्फाइड जितने भी बॉन्ड्स होते हैं सबको तोड़ देता है, दैट इज बिटवीन लाइट चेन एंड द हेवी चेन, एंड वन दैट इज प्रेजेंट, ठीक है, सबको तोड़ देगा, तो व्हाट विल हैपन? इट विल कॉज व्हाट द दिस इंडिविजुअल chains will be formed of the heavy chain and light chain, that is total 4 fragments. इसमें दो तो अपनी light chain होगी and 2 heavy chain, so causing what? 2 light chain and the 2 heavy chain. Okay, now coming to the next question, that immunoglobulin isotype class which always determined by the constant region of the heavy region, variable region of the heavy chain, or constant region of the light chain, or variable region of the light chain. So this is the antibody, and we are talking about the isotype. हम तीन चीजें पढ़ी थी, that is the isotype, allotype, idiotype. So immunoglobulin isotype class switchover is due to what? ड्यू टू व्हाट? ड्यू टू द पहली बात तो ये कि वो कांस्टेंट रीजन की वजह से होता, तो वेरिएबल रीजन तो वैसे ही चला गया. नाउ व्हाट वी टॉकिंग अबाउट द कांस्टेंट रीजन ऑफ विच चेन, दैट इज द हेवी चेन. सो अपन जब बात करते हैं इडियोटाइप, ठीक है, दैट दे हियर द इडियोटाइप दैट इज प्रेजेंट ओवर द वेरिएबल रीजन. ठीक है, it is present over the variable region of the light chain and the heavy chain. And when we talk about the isotype, it is at the constant region of the heavy chain. Now when we talk about the allotype, it is also present at the constant region of the heavy chain, but what happens, allotype is due to the allelic difference, because of that the class is present. Now isotype, we have seen that the 5 classes that we see, that the gum they, and that is due to they vary each other amino acid sequence where at the constant. Just remember how do we remember by the small trick कि है ना, idiotype is idiot, so it is present outside to get exposed. तो बाहर की तरफ है, तो वेरिएबल रीजन की तरफ है. ठीक है, एंड बचा अपना आइसोटाइप एंड द एलोटाइप. ए से ए, एलोटाइप इज ड्यू टू allelic differences causing the difference in the amino acid sequence, and isotype is due to the constant region of the heavy chain. ठीक है, idiotype is due to difference in the amino acid sequence in the variable region is called the idiotype, right? Allelic A से A, that we saw about the कि they inherit multiple alleles due to exit for the same allelic genes, and it is present where the constant region of the immunoglobulin molecule. So easy to remember, isotype, idiotype and allotype. A से A allelic multiple alleles की वजह से, difference की वजह से, isotype, idiotype बाहर की तरफ, that is the variable region, and isotype towards the constant region of the heavy chain. Now immunoglobulin that changes in the variable region is called, पहले आ गया वेरिएबल रीजन, अपन देखा कि वेरिएबल रीजन पे सिर्फ एक ही है जो कि प्रेजेंट है, दैट इज द इडियोटाइप, एंड रेस्ट द एलोटाइप एंड द आइसोटाइप, दैट इज ड्यू टू द कांस्टेंट रीजन. नाउ variable portion of an immunoglobulin is due to the amino terminal, carboxy terminal, acid or amoxy terminal. Now this is the variable region we are talking about. This is the constant region. ठीक है, तो वेरिएबल रीजन इज ड्यू टू व्हाट, ड्यू टू अमीनो टर्मिनल दैट इज प्रेजेंट, and carboxy terminal is causing giving what, the constant region. C4C we remember. So variable region and is amino terminal, and the constant region and is what, the CH4 region. Now vaccination is based on the principle of the agglutination, phagocytosis, immunological memory, or the clonal detection. Now on what basis the vaccination is based? Now vaccination is based on the immunological memory. Immunological memory, क्योंकि हमने देखा था कि that primary immune response and secondary immune response. ठीक है, तो जब अपन फर्स्ट डोज देते हैं, दैट फर्स्ट डोज, द प्राइमिंग डोज विल कॉज द प्राइमरी इम्यून रिस्पॉन्स. ठीक है, फॉर विच IgM and IgG are responsible, and when we give the booster dose, the secondary immune response will be present due to the IgG mainly. ठीक है, and therefore we say that a booster dose is more useful than the priming dose. ठीक है, so that is the, and one basic difference in the priming this primary and the secondary immune response, that is what is important to remember कि यहाँ पे lag phase या latent phase present है ठीक है, लैग फेज और द लेटेंट फेज, बिकॉज इट इज द टाइम पीरियड दैट इज टेकन बाय द इम्यूनिटी टू एक्टिवेट एंड टू फॉर्म द एंटीबॉडीज, ठीक है। जबकि यहाँ पे देखिए ईदर द लैग फेज इज एब्सेंट और इज वेरी स्मॉल, ठीक है। सो इज एब्सेंट और वेरी स्मॉल इन द सेकेंडरी इम्यून रिस्पॉन्स। तो एक डिफरेंस तो ये हो गया। एंड अनदर डिफरेंस इज दैट इट इज द IgM एंटीबॉडी दैट इज द फर्स्टली अपीयर्स एंड लेटर द IgG, जबकि सेकेंडरी इम्यून रिस्पॉन्स में IgG इज ऑलवेज इन द हायर कंसेंट्रेशन फ्रॉम द स्टार्टिंग, ठीक है। Second, therefore IgG is mainly responsible for what the secondary immune response. So this is the second difference. Now third difference is that the negative phase is present in the secondary immune response, ठीक है। तो नेगेटिव फेज का मतलब क्या है? नेगेटिव फेज का मतलब ये है कि जो पहले से एंटीबॉडीज प्रेजेंट थी प्राइमरी इम्यून रिस्पॉन्स में, कुछ एंटीबॉडीज रह गई दैट आल्सो रिएक्टेड विद द कमिंग सेकेंड एक्सपोजर ऑफ द एंटीजन। नाउ द एंटीबॉडी इज decreased in the concentration for a while, and that phase is what? That phase is what? Negative phase, ठीक है। वो क्या है अपने पास? नेगेटिव फेज, ठीक है। एंड व्हाट हैपेंस इज द सेकेंडरी इम्यून रिस्पॉन्स, द एंटीबॉडीज सच in large concentration they are formed, so they secondary immune response is what they will show the brisk immune response, right? जबकि primary immune response will be what? It will be slow and sluggish, ठीक है। This will be slow and sluggish. Now this we already seen, the negative phase is present and the antibody search is very high. Now antibody diversity is due to the gene rearrangement, gene translocation, antigenic variation, mutation or CD440 molecules. Now this PGI question, so more than one answer will be correct. We are talking about the this gene diversity. When we are talking about, it is due to mainly due to gene rearrangement and the mutation that is present, ठीक है। So that is mainly the somatic mutation, somatic hypermutation, that are one of the important mechanism for the antibody diversity, and other than this mutation causing the gene rearrangement. Now, which of the following statement is true about the isotopic variation? Isotopic हमने देख लिया क्या था? That was due to what? Due to what? Due to the, now we have to see the true statement that results due to subtle amino acid changes resulting from allelic. जहाँ पे allelic word we are talking about, it is not due to the isotype, it is due to what? This allotype. ठीक है। नाउ दिस रिजल्ट्स विल चेंज द अमीनो एसिड हैवी एंड लाइट चेन एट वेरिएबल रीजन। वेरिएबल रीजन तो होता ही नहीं, इट वाज ऑलवेज एट द कांस्टेंट रीजन। Changes the heavy light chain in the constant region, and it is mainly due to the change in the heavy chain, right? There are areas in DNA that bind specifically to the antibodies. No, the specific site at the antibody that also binds with the antibody are not present in the constant region, they are present in the hyper variable region of the variable region, ठीक है। So this is C is true in this case. Now, all of the following statements about hybridoma technology are true, except that is we have to correct out, mark out the false one. That is specific antibody production cells are integrated with the myeloma cells. Myeloma cells with mutation salvage pathway grows well in the HET. Aminopterin inhibits de-novo, and NGPRT are required for the salvage pathway. Now the medium that we use for the hybridoma is a hypoxanthine aminopterin thymidine medium, and the purpose that we use the HED medium is that because when we fuse the different cells of, that is when we fuse the myeloma cells, and the splenic cell, our main aim is to segregate those cells so that we can culture and perform the can take out the monoclonal antibodies. So we do not want the myeloma cells, because myeloma cells, they do not grow in the HAD medium due to deficiency of the enzyme HGPRT, ठीक है। So myeloma cells with mutation will not grow well in the HAD medium. Now, myeloma cells lack the HGPRT enzymes as they cannot grow in the HAD medium, right? So, our main principle of the hybridoma technique is to take out the monoclonal antibodies and to segregate it Now this is we see so that the antigen that is sensitized, the mice is sensitized, and from this the splenic B cells are taken, which are fused with the myeloma cells. Okay. Now why we take out the myeloma cells? Because the multiplication capability of myeloma cells is very high, and we have fused the B cells from where we want to take the antibody. Now we use the HED medium. Now HED medium, what will happen that myelosoma cells individually not replicate क्योंकि उनके पास HGPRT enzyme नहीं है for survival, and the B cells doesn't have the individual B cells will not have the multiplication ability. Only the fused cell will only grow in the this HET selective media. So therefore we helps in the segregation of the media. Now, this of culture. Now, which of the following is associated with class-specific antigen determinant of the immunoglobulin? That we are talking about the isotype that was mainly responsible for the subclass antigenic determinant for the antibody, that is the GUM-D. Okay, IgG, A, M, D, and E, and it was due to what? Due to the constant region of the H chain, heavy chain. Okay. Now, antigen binding site on antibody is hinge region, constant region, variable, hypervariable, or idiotype region. Look, hinge region and a constant region पे तो कभी bind होता ही नहीं है antigen. Antigen will always bind here. ठीक है? And which part of the antigen binding site, when it is given as a variable, hypervariable region, it is mainly what the hypervariable region. ठीक है, where the antigen will bind, because the hyper beta region, hyper variable region is mainly responsible for the antigenic binding site. Therefore when two options are given, it is a hyper variable region and it is what an idiotypic region. So we were talking about the both heavy chain and light chains are divided into constant to the variable region, and variable region amino sequence is variable, and we have a hyper variable region, that is a hot spot where the antigen will bind, and it is the idiotypic region that we've already seen. In which of the following the two alleles are inherited together? As we already know that this is what, this is nothing but allotype. Okay, that is allelic variants within the constant regions are known to exist for some of these isotypes. Now, which of the following statement is true regarding the kappa, lambda, and the heavy chain? That is, they are coded in the same site of chromosome. They are coded in a different site of the same chromosome. These chains are formed by the genetic rearrangement. Different chains are coded by the different chromosome. Now, when we talk about the chromosome for the heavy chain, for the kappa and the lambda, like, so it is what the kappa, it is chromosome number 2, and for the lambda it is chromosome number 22, and for the heavy chain it is chromosome number 14, that is encoding. So इसका मतलब क्या हुआ कि both the heavy chain and the light chain will be encoded by the different chromosomes. So this has been clear, and these chromosomes are important to remember. That is lambda. How we remember lambda? That is appearing as a 2. So lambda, that is coded by the chromosome number 22, kappa by the chromosome number 2, and the heavy chain by the chromosome number 14. ठीक है, so different chromosomes will encode the different chain. Now when we talk about the heavy chain and the light chain, even in the light chain, kappa and lambda, they are never present together at the same time in the same antibody, and they are encoded by the different chromosome. ठीक है, and we are seeing what ki different chains of the same immunoglobulin, that is the heavy chain and the light chain present in the same immunoglobulin, they are coded by the different chromosomes. So what is true in this? That is the different chains of the same immunoglobulin are also coded by the different chromosome. Now, when papain cleaves the IgG and antibody, it produces what? It produces, we have already seen, that is the 2, 5, and 1 FC. This is a repetitive question. True about immunoglobulin, that is IgG has maximum concentration, IgM, A, or E. Now, what is true? That is, we remember it by the mnemonic GUM-D. So, what will be true in this case? What is true in the stress? That is the IgG, which has the maximum concentration in the serum. And the sequence we've already seen by the mnemonic, that is the gum C. Now, IG gum D, that is the IgG. We first talk about now IgG has the maximum concentration. Since it has maximum concentration, so maximum daily production. इसके अलावा maximum concentration T half life will be maximum, that is the 23 days, and the half life having the maximum serum concentration. ठीक है, तो IgG का maximum concentration है serum में, तो maximum daily production भी होगा, तो half life भी ज्यादा होगी. ठीक है, this is how we can remember. चार सब क्लास है, that is IG1, 2, 3 and 4, and they all differ from each other on the basis of the heavy chain. So just remember 4 सब क्लास है, 1, 2, 3, 4, and half life maximum है, maximum daily concentration है, and the maximum serum concentration है. Now what we have to remember, that complement we have already seen, it is the 312, that is IgG 3, 1 and then 2, that are potent for activating the complement system. And apart from this, the IgG2 has the poorest ability to cross the placenta, as well as IgG2 is also weak in the fixing the complement system. And when we talk about the phagocytosis, also the IgG2 has the low affinity for the phagocytosis as well. Because क्यों? क्योंकि IgG and M also takes part in the opsonization. Therefore, IgG2 is poor in everything, in crossing the placenta, in activating the complement system, as well as in phagocytosis. Now coming to the IgM, very important point about the IgM is that कि IgM जो है इसका highest molecular weight है, molecular weight highest है. क्यों? क्योंकि ये पेंटामर होता है. therefore अगर molecular weight highest है तो maximum sedimentation coefficient भी है. ठीक है. Now it has what? It has highest molecular weight क्योंकि it is what? Pentamer, and maximum sedimentation coefficient as well. ठीक है. And it is mainly what? It is mainly intravascular. अब ये दो फॉर्म में होता है, that is monomer and pentamer. ठीक है. Now monomer, it is present on the surface of the B cell, and when it is released intravascular, it will be released as pentamer. ठीक है. And एक एंटीबॉडी के पास दो फैब फ्रेगमेंट होते हैं, मतलब दो वैलेंसीज होती, तो आईजीएम के पास कितनी वैलेंसीज है? 10 वैलेंसीज. नाउ अक्यूट इन्फेक्शन, आईजीएम इज द फर्स्ट एंटीबॉडी टू राइज in an infection, in intrauterine infection, in complement fixation it is the most potent antibody क्योंकि ये पेंटामर होता है, इसके पास 5 एफसी फ्रेगमेंट है. therefore it is most potent than IgG 312. Apart from this, IgG and IgM are also potent for the opsonization. Now fetal immunity we have seen, it is the first antibody to be synthesized in the fetal cell, fetal life, and protection against the intravascular organisms. Now immunoglobulin A, जब अपन A की बात करते हैं तो it is the second most abundant, ठीक है, and it is also exist in monomer and the dimer. But predominantly it is a monomer, and it is also of two types, that is IgA1 and IgA2. And what we have to remember that ACA, that is it is responsible for antibody dependent cytotoxicity. ठीक है. Now it is what it causes to protect the local mucosa, that is provides the local immunity or the mucosal immunity or the secretory immunity, and it's present because it provides secretory immunity, so it is present in what? The secretion, that is a milk, saliva, tears, respiratory tract mucosal secretions, and intestinal secretions. So that is predominantly found in secretions. So क्या क्या important points है? A से A, that is it is providing ADCC, local immunity, mucosal immunity, secretory immunity. So secretory immunity is presence in the secretions, right? Now moving next is secretory, we have seen that is it is situated near mucosal, it is synthesized by the plasma cells that is situated near the mucosal epithelium, providing the mucosal immunity. Now subclass is, we have seen IG1 and 2, and it is predominantly IgA1 more than IgA2. ठीक है, that is present in higher concentration, but IG2 is present in higher concentration in nasal and the male genital secretions. Now talking about the IgE Now IgE, what is the lowest serum concentration? ठीक है, अब इसका लोवेस्ट सीरम कंसंट्रेशन है तो टी हाफ भी लोवेस्ट होगा एंड मिनिमम डेली प्रोडक्शन, ठीक है, दैट इज द मिनिमम डेली प्रोडक्शन एंड इट इज IgE was IgE very important to remember is what is an हीट लेबाइल इम्यूनोग्लोबुलिन, ठीक है। तो आईजी सबसे कम लोवेस्ट प्रोडक्शन होगा सीरम में, हाफ लाइफ सबसे छोटी होगी और मिनिमम सीरम कॉन्सेंट्रेशन विद द मिनिमम डेली प्रोडक्शन, ठीक है। एंड इट इज हीट लेबाइल एंटीबॉडी, वेरी इंपॉर्टेंट, दैट इज इट इज हीट लेबाइल एंटीबॉडी. And where it is present on the cell of the tissue cells, that is mast cell, taking part in the type 1 hypersensitivity. Now functions, it takes part in the type 1 hypersensitivity, allergic and anaphylactic reactions that we've already seen. Now it is also elevated in the helminthic infection. It is a very important question that it is also elevated in the helminthic infections. Okay. Now it release IgE stimulates the release of the mediators on the surface of the helminth by process known as the ADCC. Now for the ADCC हमने देखा ADCC1 was caused by the IgA also, and here IgE also, and hypersensitivity also we saw that how the ADCC was caused by the IgM and IgG. So it is elevated in the helminthic infection and type 1 hypersensitivity. What points about IgD is important, that one very important point that is present on the surface of the B cell, और B cell के surface पे IgD भी होगा और IgM का मोनोमर भी होगा, that is monomer form of the IgM. Now IgG that helps in opsonization, that is what? IgA, G, D or E. This is what? IgG that helps in opsonization. Two antibodies that helps in opsonization is IgG and IgM. ठीक है. Now coming to the next question, that is the serum concentration of which of the IgG class is maximum. This is very easy, that is gum day. The serum concentration was gum day, and in G that is a 1, 2, 3 and 4. Okay, it is IgG1. Which of the following immunoglobulin can cross the placenta, that is IgA, M, G and D? Which immunoglobulin crosses the placenta? We've already seen, that is what? This is IgG. Okay, and the poorest that is crossing the placenta is IgG2, that is poor everywhere, that is in even the fixing the complements and in the crossing the placenta. Okay. True about it is also present in the breast as well, that is it is secreted also in the breast milk, that is along with the IgA, because IgA is present in the secretions. Now true about the antibodies, that IgM is produced in the primary response, IgG protects mucosa, Ig is the main antibody in the secondary response, or IgG is the main antibody in secondary response, or IgA protects the body surface. What is true in this case? So what is true in this case? Multiple choice PGI, so multiple options will be correct. IgM is produced in the primary response. This is true. Ig doesn't protect the mucosa. It is IgA that protects the mucosa. Ig is not the primary antibody in the secondary response. It is the IgG, and IgA protects the body surface or the mucosa. Now, which antibody deficiency causes the recurrent infection with the polysaccharide capsule? That is what? That is that is IgG2 deficiency. Now, which of the following about the innate immunity is wrong? That is, immune response occurs in minutes, non-specific, first line of the defense, or need prior to contact with the antigen. We are talking about what the innate immunity. Okay, so immune response occurs in the minutes. This is true because the response occurs in the minutes, and since it is present from birth, so it is non-specific and it is the first line of defense. This is also true, but since it is non-specific presence in the since the birth, therefore prior contact of the antigen is not required, so this is false. Now, which of the following is true about the active immunity? That is, no lag phase, booster dose is useful, no memory cells or useful in immunodeficient people. Now, the first thing that we talked about, that in immunodeficient people, active immunity will not take part, क्योंकि active immunity के लिए खुद की immunity को active होना जरूरी है, which is not possible in the immunodeficient people. ठीक है, so now coming to the next, that is the primary immune response. The correct statement is involves IgG. Memory B cells are the antibody producing cells. No lag phase, slow and sluggish. So what is true? That is involves IgG. This is false because the primary response, it is what, the IgM. Okay, and memory B cells are the antibody producing cells. This is also false because they takes part in the secondary immune response. No lag phase in the primary immune response. Lag phase is present and it is slow and sluggish. This is also true. Now, innate immunity differs from the acquired immunity in all except, that is, it is present from the birth, diversity is limited, immunological memory is absent, and prior antigen exposure is must. So it is also a repetitive question, that is innate immunity differs, that prior antigen is not required. Now, toll-like receptors is a component of what? Innate, acquired, active, or passive. Now, toll-like receptors, they are present on the surface of the phagocytes, that is the pathogen-presenting receptors are present. They are pathogen-presenting cells that are phagocytes, and on the surface of that, the toll-like receptors are present, which recognize the microbe, through their receptors, that is the MAMs that are present. On the surface of the microbe, and TLR, they actually recognize these microbes and they are non-specific. So TLR is always a part of the innate immunity. Please remember this, very important. Very important to remember that it is a part of the innate immunity. Now, which of the following cytokine is an important of the innate immunity? We read about the cytokines of the innate and the active immunity. तो हमने देखा था कि एक्टिव इम्यूनिटी में इट वाज इंटरलूकिन 245 that was taking part in the active immunity. And interleukin taking part in this innate immunity. Now, acute phase reactants are all except amyloid, serum amyloid A, C-reactive protein, fibrinogen, and the coagulase. Now, what is not the acute phase reactant? This is the coagulase is not an acute phase reactant, because we need to remember the positive and the negative phase reactant. For that, there was a list and I will repeat that list. Now, negative acute phase reactant proteins are all except the albumin, alpha 1 acid glycoprotein, transferrin, or antithrombin. We remembered it by the mnemonic, that is a NATA, that is a negative, and A for albumin, T for transferrin, and A for antithrombin. So alpha 1 acid glycoprotein is not in negative phase. This negative acute phase reactant protein. So it is NATA, that is albumin, transferrin, and antithrombin. So acute phase reactants, they are actually main site, that is the liver. But apart from this, they are also produced by the endothelial cells and fibroblast cells. Now positive, that is their level increases due to acute inflammation, that is the complement proteins, coagulation proteins that we have to remember. Now, most important is to remember the negative phase protein so that it's easy for you to exclude. And they also, apart from the this normal inflammatory reactions, they also rises into normal conditions such as pregnancy and exercise. That is C-reactive proteins that are increasing. It is example of what the acute phase reactant proteins. And the level we have to remember that it is normally less than 0.2 milligram per deciliter, but if it is rising up to 1 milligram per deciliter, then it is considered to be rise in the exercise and pregnancy. And it is more 1 to 10 milligram per deciliter, it will rise in bronchitis, cystitis, and the pancreatitis. And more than 10, that is a marked increase will occurs in the major trauma or systemic vasculitis, that is the systemic infections, it will take place. Now just note down the name that the test we used can be detected by the precipitation method, latex agglutination test, and the highly sensitive CRP. Now, which part of the bacteria is most antigen? We have seen that is the protein. Now, which of the following antigen is T dependent? Is also repetitive question. I guess we have done, that is the acha, this is not we have done. Which of the following is the T dependent? We read about two antigens, that is a T dependent and T independent. And what were the examples of the T independent? That is everything that is outermost to the cell. That is, one is the capsule, another is the flagella, and another is the lipopolysaccharide. So it is an exotoxin, that is not the T independent. So it is T dependent antigen. And what was the T independent antigen was doing? Directly activating the B cell, causing the polyclonal activation. And this was causing what? The polyclonal activation of the B cell, and causing this was causing what? The hyper gamma globulinemia. Two of the following is that Ig will cross the placenta. Half-life of IgG is 23. IgD is heat stable, and IgE has the highest concentration of the carbohydrate. Okay. So what is true? Multiple choices are correct in this case. So what is true? That is IgG cross the placenta. No, it is the IgG that crosses the placenta, and IgG 2 is the poorest to cross the placenta. Okay. Half life of IgG is 23 days. This is true. Okay. And IgD is heat stable. Only IgE is the heat labile that we have to remember. Rest are what? The heat stable. Only IgE, that is the heat labile, that rest are the heat stable. And IgE has the highest carbohydrate concentration. The highest carbohydrate concentration is present in IgD. It's also false. Okay, so is what we at half life is 23 days. Heat IgG, it's what? Heat stable, because it is IgE, that is heat labile, and IgD has highest carbohydrate concentration. Now, activate of the classical pathway of the complement system is what? The highest So what is the activity of the classical complement pathway? That is the IgM and the IgG, both are the activity of the classical complement pathway and remembered by the mnemonic MG312. So both are the activator, but one is asked, then it will be IgM because it is more potent. Now pentameric antibody with the JHL, this is very simple. I'll just give you 5 seconds for this. That is what? Pentameric antibody with the J chain. Okay? That is what? That is IgM because it is existing in two forms, that is the monomer and the pentamer, and the monomer form to form a pentamer form is by the J chain. Which immunoglobulin act as a receptor on the B cell? There were two immunoglobulin that were present on the surface of the B cell, and they were what? One was IgD and another was what? Another was IgM का monomer form. In utero, infection leads to the rise of which of the following immunoglobulin first? Now, which is the first immunoglobulin that is formed, and which is the first immunoglobulin that will rise in the in utero infection? That is what? IgG, A, Ig, or M. This will be what? This is IgM. That is the first antibody to rise in the in utero inflammation. The first antibody that is found, that is formed. Now, rheumatoid arthritis is best diagnosed by it is more than one answer is correct. That is anti-citrulline antibody, IgG, A, or M. That is what it is best diagnosed by what? That is best diagnosed by anti-citrulline antibody and also IgM antibody, because anti-citrulline antibody is nothing but type of the IgM antibodies that are detected in the blood and joins the patient with the rheumatic arthritis. Now, when anti-citrulline antibody is found in the patient blood, there is 95% chance that the patient has the RA, and it is also directed by the rheumatoid factor. So rheumatoid factor is the IgM antibody directed against the FC portion. So anti-citrulline antibody, and next is the IgM antibody, because rheumatoid factor is nothing but a rheumatoid factor is what? It is an IgM antibody that is directed against the FC portion of the IgG antibody. So rheumatoid factor जब ये IgG antibody है, यहाँ पे जो FC portion है, that is here the IgM antibody is found, and this is what we say that rheumatoid factor, right? And very important test we see for the detection is the Rose-Waller test for the rheumatoid. RCR, that is RC, that is the rheumatoid factor, and RC Rose-Waller's test that we use for detection of the rheumatoid arthritis. The most avidly complement fixing antibody is what? We have already seen this, again repetitive question, that is Mg312, that is what? IgM, because it is what? It is pentameric with 5 FC region, और IgG के कम से अपन को कम से कम 2 IgG चाहिए हुए होते हैं to activate complement system, while 1 IgM is enough because it is in pentameric form. Which antibody is elevated in primary immune response? That is what? That is IgM will elevated first, then IgG. Which is the first antibody that is elevated? So again we have done this question, that is what? That is IgM. Synthesis of an immunoglobulin membrane bound secretive form is determined by the, this is important question, that is 1 or 2 turn joining rule, class switching, differential RNA processing, or the allelic exclusion. So what will be the answer here? That is synthesis of immunoglobulin membrane bound or secretive form is determined by differential RNA processing. So it is a common transcript that determines whether the secretive membrane form of immunoglobulin will be produced or not. Now immunoglobulin in the pairs patches is, now immunoglobulin in the pairs patches is, since it is present near the secretory area, so what will be it? It will be IgA. So it is what? It is nothing but IgA. Although we doesn't know about the pairs patches, but we know that pairs patches is present in the intestine and the secretory immunoglobulins are present in the intestine. So it is what? It is IgA that will give the local immunity or the secret immunity, and it is also present in the secretions of the milk, saliva, tears, respiratory tract in secretions and the intestinal secretions. Now immunoglobulin that is present in the local secretions, that we've already seen that it is what? IgA. Or another important point was it was causing ADCC, and it is what? Secretory immunoglobulin, and two forms, that is IgA1 and IgA2. The secretory component of the immunoglobulin molecule is what? Found by the epithelial cells of the lining mucosa, found by the plasma cells or epithelial cells and the plasma cells, and secreted by the bone marrow. So that is, we are talking about the IgA antibody, secretory antibody, and what is true in this case? That it is formed by, we saw that it is formed by the plasma cells and the epithelial cells that are present near the epithelial lining of the mucosa cells. Okay, so it is present both in the monomer and the dimer, and it is produced by the mucosal epithelium. Now immunoglobulin that is inactive by the heating, that is heat labile immunoglobulin is which one? Only one immunoglobulin is what? Heat labile, that is IgE. Rest are what? Heat stable. Now, immunoglobulin that is elevated in the helminthic infection. Helminthic is infected what? An allergic infection, and anaphylaxis also occurs. So, which antibody will rise in type 1 hypersensitivity? That is what? Nothing but IgE. IgE is secreted by, this is important questions because most of people do tend to wrong it. That is what? That is IgE is secreted by the mast cell, basophil, plasma cell, eosinophil, and the neutrophils. It is actually plasma cells. Don't confuse with the mast cell, basophil, and eosinophil, क्योंकि उन पे जाके तो IG attach होता है for the sensitization of the mast cell to release the mediators. So it is actually secreted by the plasma cell, because plasma cells form the antibodies. Now, which of the immunoglobulin is scarce in human? We know by the mnemonic, that is the gum, they, that is what? It is IgG, A, M, or D, and E. So it is which is the least in concentration? IgE. It is the lowest in concentration. So per day daily concentration formed is also low, and the T half life is also low, and it is the heat labile toxin. It is what? The heat labile toxin, which precipitates at 50 to 60 degree but resolve on heating. This is what we are talking about, the Benz-Jones proteins. So they are coagulate at 50 degrees Celsius and resolve at 70 degrees Celsius. So they are what? The Benz-Jones proteins in the multiple myeloma. So next question, Nagler reaction is an example of what? Nagler's reaction is what? We remembered it to Nagler reaction is what? Nagler reaction, that is N for N, that is it is an toxin antitoxin neutralization test, because what we do for the Clostridium we detect, and what we do ki one side the antitoxin is placed, other side no antitoxin. So when we placed the this Clostridium toxin, it has the anti-lecithinase activity, and it will precipitate down and so show the area of precipitation in the egg yolk serum, causing the opacification and showing the Nagler reaction, the toxin, antitoxin, oxoxin neutralization. So this is the for we do the Clostridium perfringens, and you can see the area of opacification here. That is, you can already see the area of opacification. That is mainly it is done for the Clostridium perfringens to see the toxin activity. Now, Coombs test is an example of what? Coombs test is example of, very easy it is, that is Coombs test is an example of, इट इज एन एग्जाम्पल ऑफ ए ग्लूटिनेशन टेस्ट, क्योंकि कोम्स टेस्ट में अपन क्या करते हैं, आईजीजी एंटीबॉडी के साथ वी अटैच द एंटी ह्यूमन एंटीग्लोबुलिन, बिकॉज IgG is an incomplete antibody. So when IgG react with the antigen, it doesn't show the visible agglutination reaction. So we attach the anti-human immunoglobulin with the this complex, showing the visible agglutination reaction. That is the positive agglutination reaction. Now, Paul Bunel test is an example of the Paul Bunel test example of the heterophile agglutination test, and what were the other example, that is the wheel Falix test and the cold agglutination test. ठीक है. Now which are the examples of the agglutination test? That is the Vidal test, Vidal Khan test, and the Escolator. We'll make a list of these tests. That is Vidal test, VDRL, because VDRL we read in the syphilis, that is VDRL nothing but it is a slide agglutination test, a slide flocculation test, that is the precipitation test. And we have to remember the list, that is the Vidal is an agglutination and VDRL is precipitation test. Kahn test is also a precipitation test, and Escoli test is also an precipitation test. So all the tests we are seeing apart from the Vidal, it is a VDRL, Kahn and the Escoli, they are what? They are slide flocculation test or the precipitation test. Kahn is also a precipitation test, and it is also a precipitation test. ठीक है. Now, coming to the next question, that which of the following will act as an opsonin? This we already read in the complement so many times, that it is the C3. It is a C3, C4, what? Because C3A, C4A, C5A, they will act as an anaphylotoxins. ठीक है. And C3B and C4B will act as an opsonins, therefore increasing the phagocytosis. Is C3B. Immunoglobulins bound to the surface of bacteria mediates phagocytosis by, ठीक है, we are talking about the immunoglobulins that is bound on the surface of the bacterial surface. It will actually what? By the C3B and the FC portion of the antibody. Now, Rose-Waller test we've already seen, that is done in the rheumatic arthritis, that is we do in the rheumatoid arthritis. Now, heterophile agglutination tests are all used in all the tests except heterophile agglutination test is used in all, that is we use it for the wheel Palix, for the Paul Bunel and the Paul agglutination test. Vidal test is what? Vidal test is not an heterophile test. Okay, so Vidal and ELISA. Skin test based on the neutralization reaction. Specifically on the neutralization one we saw was the Nagler's reaction in the Clostridium perfringens, that we need to remember. Another test that we do is what? The Schick test. ठीक है, that we do the Schick test because it is neutralization क्या होता है, antigen antibody they are neutralizing each other, and one was the Naegler's reaction that was seen, and there is Schick test that we also do for the diphtheria. ठीक है, the Naegler reaction we were doing for the Clostridium perfringens where the toxin antitoxin neutral activity was seen, and the Schick test that we are doing for the this diphtheria to see the toxin antitoxin न्यूट्रलाइजेशन टेस्ट. ठीक है, now this is Schick test. Nagler reaction we have already seen. Now prozone phenomena is due to now two phenomena, that is one is the prozone, another is the post zone, और बीच में zone of equivalence that was given by the Marx lattice hypothesis, that is prozone when we take the tubes where the antibodies are in axis, right, and in the zone of equivalence antigen and the antibody will be in the zone of equivalence, and post zone where the antigen will be axis. So agglutination reaction will be best seen in the zone of the equivalence. So prozone is where the antibodies are axis. Marx lattice, this is Marx lattice hypothesis that we have just seen. Now next is the prozone phenomena is a feature of which organism, that is Tularemia, Legionnaire plague and the Brucella. That is what? It is an exact feature of the Brucella. That is prozone phenomena is seen in the prozone phenomena, or the antibody axis is seen in the Brucella. And another important example is what? The syphilis, typhoid. ठीक है, and remember one post zone, that is cryptococcus. ठीक है, one prozone and one post zone. For prozone we have to remember the brucella, syphilis and the typhoid, and post zone for the cryptococcus. Antigen antibody reaction maximum is seen where? 5 seconds for you. That is seen where? Seen where? Seen in the zone of the equivalence, that is antigen antibodies are equals because axis of antibody is prozone and axis of antigen is what? The post zone. Okay, now which of the following is true but in is wrong? This way I guess we have already done this question. ठीक है, complement forms that are formed in the liver are, this is also important because we tend to forget this. Complements that are formed in liver are हमने इसको बहुत इजी तरीके से याद किया था कि लीवर इज व्हाट एंड मल्टीपल ऑफ 3, दैट इज 3, 6 एंड 9. स्प्लीन को ऐसे याद किया था कि एस तो 5, तो 5 एंड 8. ठीक है, जी आई टी को ऐसे याद किया आई, तो दैट इज कॉम्प्लीमेंट फैक्टर नंबर 1, बचा 2 एंड 4. सो दिस इज हाउ वी रिमेंबर्ड लीवर इन द मल्टीपल ऑफ 3, 6, 9, एस से 5, ठीक है, 5 एंड 8, जी आई टी से आई से 8, एंड मैक्रोफेज 2 एंड 4. सो दीज आर द कॉम्प्लीमेंट दैट आर फॉर्म इन द liver. Now wheel and flare response is a type of what? Sequence is also important for the wheel and flare, that is पहले arrhythma बनेगा, then flare and last में wheel. ठीक है, due to congestion and the swelling of the area due to accumulation of the blood in the surrounding capillaries. It is seen where in the type 1 hypersensitivity. नाउ एलर्जिक राइनाइटिक्स, वी whenever we talk about the allergy, क्योंकि हमने न्यूमैनिक दैट वी रेड अबाउट द ए एसिड that is a type 1, type 2, type 3 and type 4, one say that is the allergic anaphylaxis and atopic. ठीक है, सी से साइटोटॉक्सिक दैट इज द एंटीबॉडी मीडिएटेड, आई से इम्यून कॉम्प्लेक्स एंड डी से डिलेड दैट इज द सेल मीडिएटेड. So when we talk about the allergic, that is the allergic rhinitis or allergic asthma and all, that is an example over the type 1 hypersensitivity. Type 2 के लिए rheumatic fever that we read, myasthenia gravis, good pastures, hematite disease of the newborn and erythroblastoses petalis. Type 3 में सब कुछ एस एस से याद क्या था, that is the serum sickness, SLE, arthritis and glomerulonephritis. And type 4 that is delayed, D से हमें याद क्या था, that is diabetes mellitus type 1, contact dermatitis and it is a delay to TB or multiple sclerosis. ठीक है. Now type 2 hypersensitivity reactions are seen in that is seen where in the myasthenia gravis and the good pastures disease. Also the hyperacute graft rejection, we remembered कि H को अपन ऐसे ऐसे लिखते हैं, that is 2, so it is also a type 2 hypersensitivity reaction, because अपन hypersensitive पढ़ा था, that is what type 2 hypersensitivity, this hyperacute rejection. Now skin tests are used in which of the following hypersensitivity reactions, 1, 2, 3 और 4. टाइप 1 में अपन ABC से याद किया था, इट इज एलर्जी, एटोपिक, एस्थमा, बी से बी स्टिंग एंड सी से कसोनीज टेस्ट. एक टेस्ट तो अपनों ने ये किया था, इसके अलावा अपनों ने 1 वी डिड द स्किन प्रिक टेस्ट, ठीक है, एंड 4th में वी आल्सो डिड द ट्यूबरकुलिन टेस्ट फॉर द डिलेड, लेप्रोमिन टेस्ट, पैच टेस्ट, and what we did the patch test and the Montegro test, depending on the disease, to see the sensitivity of the person, so in the type 1 and the type 4. Now graft rejection due to preformed antibodies is, now preformed antibodies are mainly see in the ABO incompatibility, ठीक है, and it is an example of the hyperacute rejection. It is mainly due to the graft rejection is mainly due to ABO incompatibility and HLA, ठीक है, और HLA में भी HLA की subtypes A and 1 and 2, and 1 में आता है A, B and C, and 2 में that is the DR, DQ and DS, and it is the DR that is the most important to match. and जब अपन 50% मैच चाहिए तो उसके लिए अपन क्या क्या मैच करते हैं, A, B and DR, and DR is the most important. so 3 सब क्लासेस भी मैच, and for each 1 gene and 2 allele, तो 6 allele हो गए, and out of 6 alleles 4 out of 6 alleles should be matched. ठीक है. Best example of the synergic graft is what? Now best example of the synergic effect is what? It is what? Between the monozygotic twins, because HLA is identical in the twins, and we read about what is a allograft, that is between the individuals of the same species, xenograft between individuals of different species, and HLA is identical in same individual cells as well as between the monozygotic twins. Now, which statement is not true about the direct pathway of the allo antigens? Now, जब अपन graft transfer करते हैं, we read about 2 types of pathways. That is, one is the direct and the indirect pathway. ठीक है, तो डायरेक्ट पाथ में क्या था कि जो ग्राफ्ट सेल्स अपन भेज रहे हैं पर्सन डोनर को, उस ग्राफ्ट सेल में पहले से एंटीजन सेंसिटाइज्ड एपीसी सेल्स होते हैं, ठीक है, एंड दैट इज ऑफ द डोनर. which will be represented to the T cell of what the recipient. This is the direct cells because सब कुछ हमने directly दे दिया to a T cells. In that pathway, the antigens that has been received by the graft cell will represent to the APC of the donor cells and later to the T cell of the donor cells, and later it rejection will occur. ठीक है, तो डायरेक्ट पाथवे की बात कर रहे हैं तो विच ऑफ द फॉलोइंग स्टेटमेंट विल बी ट्रू, दैट MHC मॉलिक्यूल्स ऑफ ग्राफ्ट एपीसी आर प्रेजेंटेड टू द रेसिपिएंट हेल्पर टी सेल्स. ठीक है, and another responsible for most of the acute graft rejection, this is true because acute graft rejection is mainly due to the graft direct pathway and chronic is mainly due to the indirect pathway. So this is also true. It is also true. Seen in the graft tissue containing the macrophage and dendritic cell. This is also true because the dendritic cells and macrophage are the antigen presenting cells. And the donor alloantigens are processed and presented by the recipient APCs. In the direct pathway, the APCs are of the donor, not of the recipient. Remember, so this is not true. C3 convertase in alternative complement pathway is in all the three system. C3 alternate converting this classical में C3 convertase क्या C14B2A, here it is C3B BB and here it is MBL C14 C4B and 2A. How we remember the mnemonic? 142 for classical and 42 for lactic and alternate C3B. So this is what the C3 convertase for the alternate pathway. Disseminated Neisseria infection is commonly associated with deficiency of what? Disseminated Neisseria infection and the Toxoplasma gondii is due to the deficiency of the late complement factors or MAC. So MAC. Rather than this, the C1 inhibitor deficiency will cause what? The hereditary angioneurotic edema. Okay? And the factor number B and H will cause what? The this alternate pathway activation. Right, and propertin also the factors will cause the alternate pathway if there is the deficiency of the factors, that is factor early complement factors or the late complement factors, their deficiency of early complement factors. तो क्या हो जाएगा? We read about कि autoimmune disease, SLE, rheumatoid arthritis, glomerulonephritis. ठीक है, and अगर MAC का हो जाएगा तो this Neisseria and the Toxoplasma gondii. Now decreasing order of the IgG, we read about the Mg for the activation of the complement, that is Mg 312. So what will be the sequence? This will be IgG 3, 1, 2 and IgG4 is not able to fix the complement system. So session is over. We are over with the immunity. Now my MCQs of the immunity. So thank you for watching today's session and do use my code, that is Muskan, to get 10% of the discount, and best of luck for your coming NEET examination. And don't panic, just have good sleep cycle and the good food, and everything you know is way better than the others. Just think that because no one is perfect and no one is going to know everything. So whatever you prepare, just don't change the subject and revise the volatile subjects daily, and do the grand test daily that is being provided by the Unacademy, that is totally free of cost, that will help you evaluate your preparation for the coming examination, right? And I will cover a general bacteriology in short session, complete bacteriology I cover. Other than this, the parasitology will be covered